the slide presentation. You have to forgive me. Landon's going to help here.
Yeah, we're.
Go on to the next slide. So this is the county status of health. I am going to present this from the health department lens because that's the lens I see through. That is not to discount all of our partners and all the other agencies in this room and online. We all work together to create change in the status of health. So next slide. Throughout the presentation, there's a lot of data being presented to you, a lot of numbers. This is where it comes from the state health improvement process, census data, the YBRS survey, the county health rankings, and all this here. So here's the general demographics of Garrett County. In the last, was it 15 years, the population's gone down 4%. Increasingly, our population is getting 65 years and older, and that stresses the importance of our safety net and our support services for a senior population. I also wanted to highlight that our unemployment rate compared to the state is a little bit higher than the state average, about on par with the United States. Our persons in poverty are a little bit higher also than the state, but under the nation as a whole. Next slide. So this data is a little bit old. Since COVID, some of the data has not been updated quite as quickly as we would normally like. These are in 2022, there were 379 deaths among Garrett County residents, and heart disease and cancer remain the leading causes of death. This is pretty much unchanged for the last several years of the data that we have. Is pretty constant or consistent, I should say. Next slide. All right, so this is the graphical presentation or visual presentation of what is the county health rankings are kind of based on and the theory behind it. The University of Wisconsin Population Health Institute model shows how the community conditions where we live, learn, work, and play affect our collective health and well-being. So the ways that our societal rules, the way they're written and the way they are used, they determine which communities have access to resources. And then the people in power are those that shape the rules and how they are applied. And that stresses the importance of this council, the Local Health Improvement Council, because we have the power to help shape the change and make the change in our community conditions and then our population health and well-being. Next slide. All right, here's all the numbers. So this is a lot on the screen. These next slides compare Garrett and Allegheny County and then Preston and Mineral County. Just because, that to show our regional variances. So first, our life expectancy in Garrett County is a good bit higher than our surrounding counties. We're at 76.8, and the others are right around 74. If you look under quality of life, the percentage of people saying they have frequent physical distress in Garrett County is 13%. On Allegheny and Preston, it's 14 and 17%. Adult obesity is 37% in Garrett County. Preston and Mineral are 41 and 43. Those saying they have frequent mental distress are 18% in Garrett County, and that's less than the surrounding counties also. Feelings of loneliness is 37% in Garrett County, which is equal to Allegheny, but slightly higher than Preston and Mineral. So the quality of life measures are reflections of our culture, and they're one of the groups of measures that we can make an impact upon in our prevention activities and how we view adult leisure and daily physical activity. Next slide. So these are our community conditions. And this slide shows the importance of prevention education in our schools and how we work with our families. and in our communities to promote healthy behavior and reinforcing lifelong habits to reduce risk. It also reflects our direct services that we provide here in the health department with WIC and Healthy Families, in our chronic disease system of care that we're trying to establish or have established, and how we're evolving to address food insecurity and incorporate food as medicine approaches. So the first line is limited access to healthy foods. And in Garrett County, that's only at 4%. The other counties are significantly higher than that. Food insecurity in Garrett County is 16% and 17% in Allegheny, a little bit less in West Virginia. If you about a little past the middle of the page, the drug overdose deaths, we've made significant improvements in drug overdose deaths in the last year. We're at 26, and especially compared to Allegheny County at 59. Then down at physical activity, we're at 26%. And the other, well, Allegheny is a little bit better, and West Virginia is a little bit worse. Next slide. So this one is the physical environment and social and economic factors. And over the past few health planning councils, we've brought in guest speakers to discuss our collaborative efforts to make changes in the physical environment and the social and economic factors. For example, the local management board has conducted a housing study to identify the areas of need and solutions to that problem. So right at the top, the severe housing problems in Garrett County are at 11%. Which is lower than Allegheny, but it is higher than Preston and West Virginia. I always personally laugh at the next line, this driving alone to work. They view this as a negative statistic. I view that as my quiet time, and I think it's a very positive thing. But it's in population health terms, it is a negative statistic to have 77% of people driving alone to work. Then down in the closer to the bottom, the children in poverty in Garrett County is 15%. Well, in Allegheny, it's 22. Preston is also 22, and Mineral 17. And then down at the very bottom, the child care cost burden. Garrett County is better than surrounding counties. We're at 29%, while the others are at above 30%. Next slide. This is just a deeper dive into the demographics that we talked about early on in the presentation. It shows that compares how our 65% 65 and older compares to the other counties. We are pretty significantly higher than the other counties. The other thing I wanted personally to highlight was the children in single parent households. We're at 19%, and Allegheny's at 24, and West Virginia counties are at 22 and 21. Next slide. All right. This comes from the Maryland State Health Improvement Plan. The SHIP is a long-term plan to address the issues identified in the state health assessment, and it describes how the state health department, the public health system, and the communities it serves will work together to improve the health of the population. So the health department was an integral part of the Building a Healthier Maryland process. We co-chaired the Women's Health Work Group. And the following slides show how Garrett County measures up to the state health improvement plan metrics. Next slide. All right, so this slide, you got arrows going down, which means obviously that the measure is decreasing. If that arrow is green and going down, that means that's a good thing. If it's red and going down, that means it's a bad thing. If they're going up, that means it's increasing. And again, red, bad, green, good. So adults reporting no physical activity, our percentage is going down. We are higher than the state of Maryland, but we're trending better in our 5-year trend. Colorectal cancer screening, our percentage being screened is going down. That's obviously a bad thing, and we're under the state average. However, persons using a primary care provider is trending up, and we're above the state average. I'm going to get into the uninsurance rates a little later on in the presentation, so we'll skip over that for now. Same with babies with low birth weight. Our breast cancer screenings are trending upward, and we are above the state average. moving in the right direction. And then affordable housing, which is always the hot topic issue. Our affordable housing is trending down, and we're just about on par with the state. Mental health emergency department visits are going in the wrong direction, and we are above the state average. Number of youth SUD treatment providers, we now have 2, just trending up, but not enough. Students feeling sad or hopeless is at 34.7% currently. That's trending down, and there's an additional slide on that later on too. For chronic disease, for diabetes prevalence, Garrett County is at 10%, slightly above the state average. You can see where we are, where the green column there in the middle, and kind of see where the other counties are also. Next slide. All right, so this is come back to comparing us to Allegheny County and to West Virginia counties. Garrett County is the dark blue at the bottom. Then it goes the most recent years over here on the left, and the furthest out years on the right. So you can see we're not changing a whole lot, and then you can see where we are compared to the other counties. So we're at 26% physical inactivity. Well, like Preston is at 33%. Minerals at 29% currently. Oh, I should mention that we have received competitive grants here at the health department that are helping to promote physical activity and also to incentivize physical activity. So we're hoping to improve these numbers that also will then help improve our chronic disease and obesity and our feelings of mental health. Here's obesity. So in this one, Garrett County is the palest green shade. When we pull a lot of these charts, we don't necessarily get to control the colors and how they're laid out. So Garrett County is the palest green shade, and so you can see where we are at all obesity. And this one's backwards from the last screen. This one, the most recent, is on the far right. So Garrett County is just above 35%. You can see it's increased since 2019, but it is better than Washington County for sure. All right, next slide. All right, access to care and birth prenatal care. So this is showing the percentage of women who have had care in their first trimester. This has kind of been a hot topic within the health department lately, so I wanted to highlight it. We're doing much better than what the Maryland rates are. Maryland rates is 66%, and we're at 78%. Next slide. All right, here's the undershort, and this chart is so hard to read, and I'm sorry for that, but it's what we have. Garrett County is this burnt orange color that has the circles on it. So here's our uninsured rate for children, and it is significantly higher than our surrounding counties that surround us. The furthest one over is adults, and we're a little bit better than Preston, but we're above the other two in for uninsured. So we are working with our partners and trying to decrease this, obviously trying to increase access to care, access to give the applications to people, and making contact. Next. Okay, another slide for access to care. This is the ratio of our population to primary care providers and providers other than physicians. Providers other than physicians are nurse practitioners, PAs, and clinical nurse specialists that can provide routine and preventive care. So you can see those numbers are not good. We are in a designated provider shortage area. Our mental health providers, there's a shortage of them just overall. Like we were constantly recruiting for them, and Jonathan Brennan will tell you we can't find them. We would hire them if we could. Next slide. Women's health and mammography screening. So the column over here shows you how the data has compared. We are definitely increasing. It has gone from 40% in 2012 to 49% in 2022, which is the most recent data we have. And we are higher than the state of Maryland. So we're doing relatively well in that area. This is Medicare people, Medicare enrollees, so they're women in the ages of 65 to 74. Next slide. Okay. This is specific to the health department. This shows our family planning services, and the program itself provides access to a range of services such as contraception, STI prevention and treatment, cancer screening, and general reproductive health. And so we just wanted to show this to show the need for family planning services, and that it's a essential healthcare to the community. Next slide. This is the birth weight infants. And this is our infants that are weighing less than 5.5 pounds. This is comparing us to the western region of Maryland. So we're just about the same as the entire state, just slightly above it. And that's the pink line that goes across. We are better off than Allegheny County, and much worse than Frederick. Next slide. This slide surprised me when Beth showed me this one, and I should at this point thank Beth for pulling all this information for us, and she's compiled this information. This is suicides in the state of Maryland, and the state overall is 10%. Suicides per 100,000 is 10%. We are at 16%. I was a little stunned at that one. So we do have just now received funding for a firearm safety campaign, and we're working with the Behavioral Health Center, which I think is coming up in the next later slide, to provide gun safety devices to our families. Next slide. Okay, so this information comes from the YRSB and the schools. Again, the arrows are meaning the same thing. If they're red is bad, green is good. So the percentage of students who experience physical dating violence is trending in the wrong direction. We're above the state of Maryland's metrics, and we're increasing. The percentage of students who are threatened or injured with a weapon on school property is trending downward, and it's below the state average. Percentage of students who were bullied on school property is trending upward. See, that's a negative example. Next slide. This is also from the YRSB. So the first one is students that felt sad or hopeless almost every day for more than 2 weeks. It's coming back down. It was up in 2021. It's going back down. That's an improvement, but we're not back to where we were in 2018. Those students who said they were seriously considering suicide has dropped significantly, but it's still at 20%. Those who said they actually made a plan to attempt suicide also dropped significantly from 2018, but it's still at 16.8%. Next slide. So this goes back to the drug overdose deaths that I was talking to you earlier. This shows all of our drug and alcohol deaths. It's 26. That doesn't show 26. I didn't catch that before. And then it shows the different types of drugs that were being used. Next slide. So for 2025, our priorities and initiatives relating back to the SHIP are chronic disease, and we're increasing our physical activity events to promote health, our access to care, like I spoke about earlier. We also have a grant to do remote patient monitoring to help people that have transportation issues, and increasing health insurance enrollment. For women's health, we're increasing women's health initiatives using also grants within the health department. And this goes to the drug or the gun violence I was speaking to earlier. We're utilizing grants and with our health education department and our Center for Behavioral Health to provide safety devices to their clients for suicidal ideations. And behavioral health, we continue to support behavioral health needs across the life force. Last slide. So as always, I'd like to remind people of the Garrett County Planning Tool, which is mygarrettcounty.com, that's tracking over 1,200 local data points and has over 3,700 planning partners and 224 action groups. So that's our centralized hub for collaboration concerning the health of our community. That's the end of the presentation. That was a lot of numbers. And do you have any questions or anything you want to discuss or anything like that?
I had a quick question about the suicidal data that you had. I know maybe 10, 20 years ago, the focus area was men from like mid-20s to 45. Has that shifted at all as far as the most suicides?
I don't know. Beth, did you find any of that in your research? Yeah, a lot of times it's hard in Garrett County because they don't, because we have small numbers, they don't decentralize that data, so they don't, sometimes they don't get broken out that way. I don't know that for sure.
Hey Jen, I saw the death rates, but do we have more recent birth rates? Like
2022 is the last that Vital Statistics has come out with.
Just curious if that's, I mean, typically we're about 250, 275 a year.
Yeah.
I was curious if that number was changing or consistent. So
Yeah, the birth ones are out there. We just didn't highlight them, but we would have 2022's data. I still have the number off the top of my head.
Cool.
Alicia?
There, I just going to perhaps suggest a partnership with us or a conversation, a follow-up conversation around the insurance, children with medical insurance, because that certainly hits us with medical assistance. And I'm just wondering if that rate means that they're not coming to us, or is it the underinsured where perhaps they don't qualify for our services, but their parents are working in a business or a service industry or something that doesn't provide insurance. So I would love to explore that a little bit more, because the low-hanging fruit, of course, is getting them into our doors and just making sure that we're catching any that we may not be. So happy to have further conversations about that.
I agree completely. I think usually if they report underinsured separately, so the uninsured is probably straight up uninsured.
Oh, okay. So that would be an even bigger concern that they're not accessing services that they could qualify for.
Yeah.
Okay, great. Thanks.
yeah, if I can compliment Alicia's comment, we at Mount Laurel, we've been putting a full court press on, we noticed self-pay rising. And as we've gone in and looked at the self-pays, it's a lot of people who qualify who just aren't exercising their options.
Mm-hmm.
So we've got a full court press on self-pay who don't have insurance, as well as Medicare recipients without secondaries. So I think there are resources available that unfortunately the community always doesn't realize that they can access. So
Right.
we're pushing that, and we're going to be involving others in the community to help us with that. So
Yeah. It's always finding the right, getting that connection made.
yeah.
Anything else? Okay, then I'm also on the agenda for nominations and health planning council members. So the terms of two of our consumer members, Edgar Harmon and Brian Bowl, have expired, and neither of them have chosen to renew their membership. Judy Carbone has agreed to be nominated, but we need other nominations to help fill the vacancies. Do we have any nominations? So the term of a consumer member is 3 years, and they may renew their membership to serve up to a total of 3 terms, which would be 9 years. And if we have other nominations, and when we go to take a vote, the vote can only be made by people who are actually on the committee, public meeting, but only actual committee members can vote. So it's for consumer and permanent members to vote. Have any other nominations? Going once? Going twice?
When's the last, I guess, today appointments, or can we think of other names and?
You can definitely think of other names. Shelley and I were talking before the meeting. I'm not sure if the bylaws say the vote has to be taken in May or not.
No, it doesn't.
Not?
It doesn't. Just by the next meeting, it would be nice to have something. We have some direction.
I'm sure all of us can think of names. It's just whether those names would appreciate it.
Would agree.
Just sort of something out and like.
Okay, so why don't we table the vote? We'll keep Judy's nomination here, and we'll table it until we get a full roster of candidates. Okay. So, and then the other position is our chairperson, and Donna has agreed to stay on as chairperson. And since she's agreed, the members need to vote to keep her on. So all in favor of Donna remaining our chairperson, say aye.
Aye.
Any opposed? All right, congratulations, Donna.
Thank you, Don.
Thanks.
Okay, our final is agency updates, and I'll start with the room. So anybody have anything they'd like to share, agency or otherwise?
I talked a lot, but the health department is hiring a deputy health officer operations. The position is closed. And for his applications, we received 42 applications. So we're in that process of going through them.
I'll just update the group briefly, and then if there's any questions, be happy to answer them. We just had our proposed budget presentation Tuesday night. I guess the highlight of that presentation, the two highlights. One is that I know anyone in the room that's involved in an agency that we fund, you work with Scott and work through Scott to come up with a reasonable number to request funding for. The proposed budget meets all of those funding requests. And at the same time, for the first time in a very long time, we are proposing a property tax cut and no tax increases. We may be the only county in the state to do either one of those things. So that's exciting for us. But other than that, if anyone has any questions, we'd be happy to answer them. But the budget seems to be the primary focus right now. Good news is Garrett County is extremely solvent and in great financial shape. A lot of credit to our finance staff who, Larry, I think will agree with me, is the best in business.
Anyone online have any comments or things they'd like to share? Alicia?
Hey there, from the Department of Human Services, Social Services, just another reminder, if you get questions or see this in the community.
All right, chairs, and I'll be back by lunch.
Sunbucks is,
Oh, I got in 5 minutes.
I want to go to lunch. So Sunbucks is the summer SNAP program. You've heard me talk about it before. That is additional SNAP benefits, supplemental nutrition assistance plan benefits to children through the summer months when they're not in school. One of the things that we've learned as across the state for our agency is that a lot of the families who received those benefits last year did not use them. It's something like only 85% of the food benefit that came to them in the summer was not cashed in from their cards. So we're looking at that internally, but some of that I think is the program rolled out last summer. It was a little bit clunky, honestly. the Sunbucks cards are a different color than the regular SNAP cards. If you don't already have SNAP, that confused people. They got these cards. They're like, I don't know what this is. So if you hear anything about that, or I guess I'm asking as just you come in contact with any of your customers, just let them know that they may be getting an additional card in the mail or additional benefits to their current SNAP benefits this summer. Those are the first payment is to go out around June 18th, and just encourage them to use them. Some of them just, again, back to our earlier discussion, the benefits are there and then they're sometimes not being utilized. So if they have any questions, they can always call our main line at 3000 and we'll walk them through any of that. Or if they lose their card, we can replace the card here locally. So if there's any issues or concerns about using those funds, we'd be happy to help them to do that. Thank you.
Anyone else online? Like to present? Okay, Grace?
Yeah, I just wanted to remind everybody that our 30th anniversary walk for hospice is June 14th, starting at 11 a.m. at the Grantsville Town Park.
Okay, thank you. Anyone else? Seeing none, hearing no one in the room? Go back to Lynn.
Fred hasn't seen it.
Oh, Fred?
Maybe you didn't mean to have his hand up.
Oh, okay. It's not. Okay.
Cassie has her hand up too.
Cassie, can you chime in, please?
I was just going to give a quick home health update. We are currently sitting at a census of 90 patients. That is the most I have seen home health be in probably the 5 years that I have been there. Currently, I had to, just due to staffing, I did have to take us down to diversion. I'm only taking acute hospital discharges at this point, and those are even being screened pretty thoroughly as far as for services until we can kind of get back up on our feet a little bit. I only have 2 physical therapists, and their evals are pushing out at 2 weeks at this point. I only have 1 occupational therapist. So I just wanted to give a quick update on that for the time being, we're only taking acute patients, and I've let all referral sources in the county know that. And then as soon as, I'm hoping only about like a week or so, just to kind of get my staff's head above water, and then we can open back up to physician office and nursing home referrals as well.
Thank you. Seeing no one else online and no one else. in the room?
Yes. Hello. Can y'all hear me? Yeah, thanks. I didn't accidentally raise my hand. I know people find that shocking. Hey, I just wanted to let people know that I've been at so Christian, Mash, and I are at the statewide mental health summit, and it's focusing on the role of criminal justice and how criminal justice has typically or traditionally been used to address and or treat mental health issues in communities. So Christian and I will be coming back and getting a local team established in Garrett County to focus on services, an array of services that can be provided for individuals that are maybe not yet involved in criminal justice, or once they are involved, how do we divert people better than what's currently being done? And the interesting thing is, we talked about data today. There's a lot of data that's out there on the role of mental health issues and substance use disorder issues and how they relate to criminal justice experiences. And so the theme here has been that mental health does not create crime. And so there are a lot of people that might have differing opinions on that. But if we can figure out ways to strategize and divert prior to people becoming involved, or once they might have an experience with law enforcement, how do we divert people into services and more suitable life choices of occupation, places to live, and supportive community environments? And so data will become an increasingly important part of this, and the work that is done in our the Office of Population Health Innovation Informatics will become more important, because yesterday, a lot of presenters were talking about the role of population health and also of just public health in enhancing and helping with the diversion of people for additional services that'll lead to more thriving lifestyles and community enrichment as well. So I just want to put that out there. Today, we're going to talk about community planning tools. And so I don't know if I'll have an opportunity to talk about mygarrettcounty.com, but if I do, I will make sure I mention that, because they want people to have access to as much information and as much resources as possible in communities. So that's all I had to say about that.
Thank you. Tiffany?
Donna, I just wanted to remind everybody that effective January of 2025, AIRS changed its name from Adult Evaluation and Review Services to Assessments Evaluation and Review Services. The main reason for the name change was we evaluate and serve individuals of all ages, and the adult verbiage was a little bit misleading. And I am announcing the change in meetings. John has posted it on social media, and I've been conducting community outreach to notify everyone of the change. And all of our referrals are now being taken by Maryland Access Point, which is through Community Action. They take the referral and then they provide it back to us, and we schedule the assessment. So I just wanted to remind everybody of the name change as they see it as now assessments instead of adult.
You? Don't see anyone else, so we will adjourn the meeting. Reminding everyone, June 26th is our next meeting, and thank you, commissioners, for doing the board talk. Thank you.
Thank you.
Yes, I will.